Nebraska is one of several states across the country easing lockdown measures imposed during the height of the coronavirus outbreak. Starting May 4th, some medical services will again be allowed, like dental and vision work, as well as surgeries scheduled in advance. Nebraska has one of the lowest coronavirus cases in the country. As of this morning, the state's health department has reported less than 2,000 positive cases and 38 deaths.
Joining us now to discuss is Governor Pete Ricketts of Nebraska. Good morning to you. Thanks for coming on. Hey, we've seen lockdown protests all over the country. How did you make the decision to reopen here, and what do you make of the backlash other governors have faced for making a similar decision?
Well, what we are looking at is our hospital capacity, and that really is what we were told by our health officials all along. Was the whole point is to make sure that you slow down the spread of the virus so that everyone who needs a hospital bed, an ICU bed, or a ventilator can get one. And right now we're at like 42% of our hospital beds are available, 48% of our ICU beds, and 76% of our ventilators. So we believe that with certain restrictions, hospitals can begin those elective procedures, and then we'll be looking at loosening other restrictions as we go into the month of May.
What would those include? What's kind of next step on the agenda?
Well, we didn't do a shelter-in-place strategy. Some other states did. So most of our businesses are really ready to be open. There's no prohibition against them doing that. But there are some, like salons and barbershops, indoor movie theaters, and so forth. Restaurants are closed to dining in. So these are some of the restrictions we're going to be looking at loosening as we go into May, to be able to allow dining room restaurants to have more in dining, to allow salons to operate under certain conditions, to allow other types of businesses that were restricted like that to be able to start operating again.
Governor, President Trump said he's going to issue an executive order, signing an executive order, halting immigration to the states. That'll happen today. The president has faced some backlash for perhaps not going far enough with that decision. Do you agree with the president's decision?
Well, I got to say, one of the things we're doing here in Nebraska is asking people who come into our state to quarantine. So I think it makes a ton of sense to say, hey, we at least during the short term of this emergency, be slowing down people coming in from other countries into the United States. Again, we want to make sure that we do the best job we can of slowing the spread of virus. And of course, we're going to be watching companies here in Nebraska who may be abusing the immigration system.
Interesting. I want to talk to you about this, Governor. We know a lot of states' governors are in the spotlight right now. Meantime, Virginia specifically has come under fire for its draconian lockdown measures. Last night, Greg Kelly reports spoke with the lieutenant governor of Virginia, was asked when his state plans to reopen. Here's what he said.
Some states are already starting to kick up the economy. Georgia, Texas, Vermont. May 1st is a target date for other states. May 15th here in New York. How about for you guys?
Those are not our target dates right here in the Commonwealth of Virginia. The governor issued a stay-at-home order that is in effect until June the 10th. But like the other executive orders are constantly being revised and monitored to make sure that we're reflecting the reality on the ground. So we don't want to set any arbitrary dates. We want to give people accurate and good information.
Doesn't sound like they're planning to reopen at least anytime soon. What's it been like to really make this decision for your state? What information are you basing this decision off of?
Well, we said all along that we're going to put together a plan that's right for Nebraska. So when the administration puts out their phased plan, that really fits in line with what we were going to do, is gradually release some of these restrictions to make sure the virus didn't get out of hand. And again, the whole point is to make sure you preserve your healthcare system. And we've also taken a regional approach here in Nebraska as well, understanding that our big cities like Omaha are maybe going to be impacted differently than some of our small towns. And so we're going to look to loosen restrictions in a way that makes sense for each region or each public health district in the state that could be different from other public health districts. So we want to make this as tailored as possible for the different parts of our state, understanding that the virus doesn't spread at the same rate everywhere in our state.
I'm talking about your state. Maryland's Governor Hogan got into a little war of words, if you will, with President Trump over Governor Hogan's decision to purchase those testing kits from South Korea. Do you think the governor made the right decision there? And have you had any trouble yourself, sir, getting testing in your state?
So I don't think there's any governor who thinks they've got enough testing in their state. And yesterday we just announced a program to be able to do about 540,000 tests that we'll be able to start ramping up here in the next couple of weeks to be able to assess people, test them, and then trace them. I mean, if you think about it, what we've done is we've quarantined the entire state. And what we want to do is really focus on the people who are impacted by the coronavirus and quarantine them. So testing is a part of how we're going to make sure we really turn this around and turn the economy back on. And so I think all of the governors are actually looking to be able to see how can we get as much testing as possible. Certainly, it's been a limiter here in Nebraska with regard to us being able to get those reagents. So by announcing this program and looking to really expand, that will help us be able to accomplish all of our goals of opening up the economy and making sure that everybody who needs that health care can get access to it.
Real quick, Governor, where are you going to reach out to get testing for your state?
So actually, we worked with a number of companies that are in Utah, Domo, Nomi Health, and so forth. They're all part of the Silicon Slopes. We got that connection through Governor Herbert there in Utah, and they've been working with us in Iowa to be able to expand this testing. So we found some folks here in this country to be able to do that.
Awesome.